record. Okay, so this is, and can you still see the thing, Giselle?
Yes.
Okay, so this says session 2, imaging 2, because the first imaging lecture, I'm gonna give you third because I find that it actually helps that way. I will try to give you on some of these sessions, I'll give you like reading post, but that one is the first one where that particular one, I'll give it to you beforehand, not because we're gonna like quiz you or anything, but just because in the actual session, we're gonna go through certain specifics from those papers, and it kind of allows you to understand what I'm talking about, okay? But for this one, it's just straight, your presence is perfect. So you saw my transition slide, right? Because I've lost actually the green square. Can you see the thing? It says normal retina?
Yes.
Okay, so what we're gonna do today is just basically understand the OCT from a very macroscopic framework. So here's your normal retina, you know this. This is a kind of a cartoon where we have, you know, the retina here, and then you have the fundus photo that you're very well aware of, the cross section of the fovea or the macula here, and then you see this fovea here, and this is what we look at, right? Now, one thing I just want to mention again is you can see at the top there's your OCT, but on the bottom, you have a very nice concordance between the actual image and the pathological specimen, but I want you to just always remember they are not the same thing, okay? So the OCT is not the same as a pathological specimen. The OCT is an interpretation of light reflectance patterns coming back to you. So if light doesn't bounce off on something, then you are not going to get any type of signal, even if there was something there in the pathological specimen. An example I give is there are certain metals, like literal like pieces of metal, that are optically clear. In other words, they're optically not dense at certain wavelengths. So you can, if you're at your regular visual spectrum and you put this piece of metal on the actual retina, you wouldn't see the retina, you would see this big piece of metal. But if you did the OCT, which uses specific wavelengths for their reflectance patterns, they would pass through them and you would see the OCT perfectly. So, and again, pathology does not equal the image, but it's kind of a reflectance pattern that sort of is analogous to it. Does that make sense? Are you there? Yeah, okay. So, and I will keep asking if things make sense. So sorry, like, I'll just get your feedback.
I just have myself on mute so that you don't hear any background.
Yeah, no. Please keep it actually off. That's, I mean, on. That way, if I ask you, you can just respond. I don't care if there's anything, any type of noise or something. So this is actually the whole purpose of doing this, is so that most of this you're going to be able to say. It's super intimidating. At least I felt that way when I first looked at it. And, you know, for all the retinal findings here, it's sort of like, oh my gosh, how am I going to memorize that? My whole strategy is to basically over-educate you such that this becomes not a big deal. Okay, that's the whole reason for teaching you retinal circuitry, and that's where the brainchild came from. So that way you could say, wait a minute, of course, that is the ganglion cell layer or what have you, okay? So this is what we're really, that's the goal at the end of all of these, that we go through it and you can actually list most of these without having to look at it. Okay, so again, here's your OCT, that's your translation. Now, the first thing that you always want to do whenever you look at an OCT is you want to identify the foveal depression. And so we have here, you know that that's the foveal depression. But the second main thing is to look at the color of the vitreous. The vitreous in this case is black. That is the correct way of having an OCT being shown. You can sometimes invert them so the vitreous is white and all the other layers are kind of inverted. That doesn't help because that makes things that are foreign to the retina show up as black instead of white. And light things that look like they're lighting up, are things that our eyes go to very well. So in this case, you know, when you see exudates from diabetes, exudates that are in the OCT come up as white, but if you had them inverted, they'd come up as black and it just wouldn't make as much sense. So vitreous has to be black in order for this whole structure kind of to start making sense. So in this case, and you always see it this way because that's how we do it, that's conventional, vitreous is black. But then I like to split up the retina into two major parts, what I call the bands and then what I call the lines, okay? Today, we're gonna focus on the bands, okay? The bands are basically the I would argue, the confusing part, the striped patterns and how do you remember what is what? Maybe you already know what they are, but I will argue that I've seen people at conferences and such, they get confused, even all of us have gotten confused looking at a band and saying, okay, which is that inner, is that outer, is that nuclear, is that plexiform? Like, it's very confusing. So the whole point of this lecture is to try to remove some of that confusion. Okay, so key practical concept number one, we're only focusing on the bands for this lecture, what I call the bands. The first thing is that vitreous is dark, as I said. You also know that vitreous is made up of loosely spaced cells and 99% fluid, okay? So that is what vitreous is made up of. And so because of that, anything that looks like vitreous, thus is darker, tends to be made up of loosely spaced cells and fluid. That's key concept number one. So that which looks like something else when it comes to a reflectance pattern probably has some quality that is the same as that something else. So if we've got two things that are looking dark, they probably have some kind of quality that's similar. Well, we already are using vitreous as our anchor. Vitreous is dark, so therefore darker zones we know should be made up of something that vitreous is made up of, which is loosely spaced cells and fluid. Does this make sense?
Yes.
Okay, so we're gonna go through and I am just gonna ask you, I'm gonna point to a layer and you're just gonna tell me whether you think it's dark or light, okay? That's literally all you're doing, okay? So I'm just gonna point to a layer and you're gonna tell me, okay? And what we're getting rid of here is the line. So, you know, these guys right here that you're looking at, these lines, those lines, like that's what we're gonna focus on later. But right now we're focusing basically on these bands, these large kind of sweeping bands that you see, okay? So get rid of it and we're gonna just point. So what is that, dark or light?
Dark.
You got it, okay? It's good, and I said vitreous, but it's dark, okay? How about this band? Not this line, but this band right here. Dark or light?
It looks dark.
Yep, it's dark. Yeah, there's not a quick trick question. Dark, okay? What about the band next to it? What is it, dark or light?
Light.
You got it. So that's light. Then how about the band next to that?
Dark.
Okay, dark. And then how about the band next to that?
Light.
Good. And then this guy right here, what would you say, dark or light?
Dark.
Good. And I'm like, I suppose, and I agree, you know, it's kind of weird and heterogeneous. And this guy is?
Light.
Correct. Totally light, right? Okay, so that's the thing. I'm going to redo it and we're just going to point randomly and you're going to tell me dark or light. Okay, this is the easy, simple, no trick questions. I don't give trick questions. Okay, dark or light?
Dark.
Good. How about there?
Dark.
Mm-hmm. How about there?
Light.
Mm-hmm. What about that one?
Light.
You got it. What about that?
Dark.
Okay. What about that?
Light.
Mm-hmm. And then this guy, always the questioning one. Dark or light? Dark.
Dark.
Exactly. I agree, right? And again, right, it's like even underneath it, it's like, but you can look next to it, right? You'd be like, okay, and you know they alternate. That's also helpful. But there you go. So dark and light. Now you've hit it on the head. So practical concept number 2. It's not confusing. I don't know why I have this here. It just eliminate point 1. I don't know why. Maybe it was confusing when I was writing it. So remember that dark equals loosely spaced cells with fluid. But what are loosely spaced cells with fluid when we refer to the retina? Well, let's assume that those are where the cellular debris are, the cellular components, the nuclei which have interspersed fluid in them. They're floating around like a bag in fluid, okay? So this is what's the analogy in the retina to vitreous, which is also loosely spaced cells and 99% fluid. That's why vitreous is super dark, because light can just pass right through. There's nothing for it to bang on. It's mostly fluid. Well, in this case, dark is going to be, again, loosely spaced cells and fluid. Well, what does that mean in the retina? It means nuclear or cells. Instead of just saying dark, it's nuclear or cells. But then let's talk about light. Well, why are those light? Well, densely packed fibers without fluid allow light to bang off of a lot of different things, because nothing is going to be so packed that light, which is like the smallest quanta on Earth, can't kind of find a way and bounce right off. So if you have a ton of packed substances in one location and you don't have a lot of fluid, which is just homogeneous kind of fluid, you're going to have a lot of banging off. And so those are going to be light. They're not going to be loosely spaced cells of fluid. They're going to be densely packed fibers with less fluid. And we in the retina know that those spots are usually axons, or another word for saying that is nerve fiber bundles like plexiform. Remember, plexiform means network of nerves. Does this make sense?
Yes.
Okay, so dark equals nuclear cells now. So instead of using the word dark, we're going to just say nuclear, or we're going to say cellular, whatever you pick. And if it's light, we're going to say axons instead of light, or plexiform, whichever you'd like, okay? And remember, easy thing, retina, thank God, light alternates with dark. It makes sense physiologically when we get to it, but it just, light alternates with dark when you're looking macroscopically. So I'm going to point to something. Instead of saying dark or light, you're going to say whatever you pick, nuclear / cellular for dark, whatever you pick, and then plexiform or axonal if you want for light. Okay. So we're going to point to that one. What is that?
Nuclear.
You got it. Nuclear. Okay. How about that one?
Plexiform.
You got plexiform or axon, I wrote, but yeah, you got it. Okay. So how about that one?
Plexiform.
You got it. Plexiform or axon. Okay. How about that one?
Nuclear.
You got it. Nuclear. How about that one?
Plexiform.
You got it. Plexiform. How about that one?
Nuclear.
You got it. Nuclear. It's like weird, but you know the alternating structure. Good. Not difficult, but at least we're building. Practical concept number 3. You know this, but we reiterate it. Outer means towards the bottom of the image, okay? Inner means towards the vitreous, or a better way for me, the way when I was learning it, I said it's whatever's in the eye. Towards the vitreous means you're more in the eye. The most inner spot of the eye is like right in the center of the eye, like in 3 dimensions, which would be smack dab in the vitreous cavity, right in the center spot. So anything that's going towards that center spot is going to be inner, okay? And anything that's going away from that spot is going to be outer, okay? So outer's towards the bottom, inner's towards the vitreous. Things named outer are in the outer zone. And there are only 2 outer layers. You know this, but I'm just saying it. One is nuclear and one is plexiform, because you've got to have, they alternate. You're not going to have 2 layers that have the same kind of color. And then things named inner or anything else are going to be in the inner zone. So outer ones have the outer designation. I'm going to show you how to determine what is outer now, because that's the question, right? So if we draw a line from across from the fovea, and I always try to do this like analogy, and then I'm not sure if it like is like getting like people like it or not. A lot of people say they like it. I don't know if they're just being nice to me. So you tell me if this works, okay? So here's a line that I'm drawing straight tangent from the fovea. If I say to myself, what is anything that is basically not touching that line, but in the outer direction is out? And I try to liken it to a club, okay? So here's the club, right? If you want to get in the club, you got to be in line. So if you're touching the line that I drew tangent, if you're touching the line or you're inside the club already, you're in. But if you're not even in line, you're out. You don't get to be in the club. Okay, so that's how I define outer here, okay? So in this case, we look and we see this line, which is, again, the line is tangent to the foveal center. We draw a tangent line, just a straight line out, and a small one, because this image kind of curves for us. So if you just imagine it to be flatter, and I drew a tangent line like this dark layer is in line because it's on the line. It's actually standing in the line, so to speak. So this is in the club. But if we move kind of more outer, this is in towards the vitreous. Anything that is not in line and is not already in the club, not already inside the eye, that's outer, okay? So if I look at this, I'm just gonna say is outer. Is this nuclear or is this plexiform? What would you say? Dark or light?
Oh, sorry.
This guy right here, is this dark or light?
Oh, sorry. Dark.
Yeah, and then so therefore it's nuclear. And then because I told you that he's outside the club, he's outer. So it's the outer nuclear layer. And then if you look here, you already told me that this is light. Well, light means what?
Light means plexiform.
You got it. So it's the outer plexiform layer because they're not in line. They don't get to be in the club. Okay, so that's the concept number. That's that concept. So then we just flip it over and we say the outers touch each other, nuclear and plexiform touch. You already know that. And the inners touch each other, nuclear and plexiform touch. And then this is true also, but nuclear never touches nuclear and plexiform never touches plexiform. That's the key concept. So you don't have to worry about that. So we're going to do this. We draw the line again. And then we say, okay, let's focus on the guys on the inside. Now, again, using my ridiculous club analogy here, if you're really, really inside the club, you're VIP, okay? And you get a special name. You don't have a name. You're not just in the club. You have special names. But if you're like in line or just got into the club, you are still just, you're designated like the schmo who gets in the club. You're still just an inner, right? So in this case, this dark line is touching, this dark band is touching the line. They're in line, that foveal kind of tangent. So I'm going to say he's in the club. He's an inner, but he's not so far in the club that he has a different name. Like he gets to he's in the VIP section, so he gets to change his name or something. I'm going to say to myself, well, This guy, this band is in line because he's right on the line. He's already in line, but he's not so special. So he's the inner nuclear layer because it's a dark layer. Then I go to the next guy that's right next to him, and that one is light, and that's the inner plexiform layer. Does that make sense?
Yes.
Okay, so I'm now going to just point to these four, and you're going to tell me if it's outer or inner, if it's nuclear or plexiform. Okay, so I'm going to point to that one. What is that?
Outer
Yep,
nuclear layer.
you got it. Outer nuclear layer. Not in the club because not in line, not towards the vitreous. So it's outer. And then it's dark, which means loosely packed cells, which means nuclear in the context of the retina. Okay, what about that one, which is this light layer?
Outer plexiform layer.
Outer plexiform layer, exactly. Not the tangent line. If I draw it, mind you, I'm not going to draw one to infinity. We just draw a small tangent line here, one that's horizontal, that's touching the foveal center. It's not, these guys are not in line. So they're not in the club. They're not in the eye. So outer, and then it's a light layer. So a lot of banging off of the stuff inside. There's no fluid there. No cellular floating stuff there. It's going to be packed axons relative to the retina when we talk about the retina. Thus, it's the outer plexiform layer. How about that guy?
That's the inner nuclear layer.
You got it. Again, draw a line on line, in the line. So waiting to get in the club, but it's going to get in. Not the VIP though, so it doesn't get a special name. Dark layer, inner nuclear layer. How about the one right next to that one?
Inner plexiform layer.
You got it. Inner plexiform layer. You know, close to the line, not special enough to get special names because not in the VIP section, but still in the club. So inner and light layer. Light is reflecting hard off this density that you see. So many different little heterogeneous things are packed together. You can bang off of these axons. Thus, it's a plexiform layer. Okay, we're going to do it again. And now you're just going to tell me, and I'm going to point to a layer.
So that is.
So dark or light?
So yeah, so it's that's the inner nuclear layer.
You got it, right? And I always say, remember, and by the way, you are not at all like this is really confusing. And again, at conferences, you'll find attendings who have been doing this for 40 years mess this up. Okay, so I always say, if you can just tell them it's a nuclear layer, then you can reorient yourself quickly, right? Yeah. So it's like, it's dark nuclear, got it. I'm not, you can't, nobody ever, it doesn't change because it's, you know, a Thursday and tomorrow this is going to be the plexiform because it's dark. No, it's always, once you learn it, dark equals nuclear, and it's inner because that tangent line right across from the fovea, they're in line or inside of that line, okay? All right, so let's go to this one.
That's outer nuclear layer.
Outer nuclear layer, dark layer, nuclear thus, and outer outside the club. Okay, how about that one?
That's inner plexiform layer.
Yep, and you got plexiform because you knew, exactly, because you knew light layer, axonal, a lot of reflectance, anything that's densely packed. And in our retina, the thing that is densely packed are plexiform layers, anything that deals with bundles of axons, almost like a cable that has a bunch of cables inside of it. Inner plexiform layer. Okay, what about that one? It's this light line here.
Outer plexiform layer.
Outer plexiform layer. Again, light means plexiform, and then because hyperreflectivity, so to speak, but it's normal, but it's hyperreflective. And then you have it being outer, because if you draw that tangent line, they're not in the club. They're out of the club. They're outside. They're further out of the eye. Okay, we got those four. Those are actually the most confusing in my opinion, but okay, we got those four. But unfortunately, when you get really inside the club, it's like the VIP section, okay? They don't have an inner designation. I think you know this, but it's a way to just think about it in a different manner. So they still conform to this cellular nuclear designation versus plexiform axonal designation in their names. So everything else holds in positioning. You know that light alternates with dark, etc. So if I point to this guy, this is light. Do you know what this layer is?
The nerve fiber layer?
Yeah, nerve fiber layer. Nerve fiber is just another word for axons together or plexiform, but in another way. We just like to, mess with people nomenclature-wise, so we feel special. So you have this nerve fiber layer, which is still an axonal layer. There's no difference. It's just, that's what it is. How about that layer that's dark underneath it, albeit it's not perfectly dark. It's a little weird looking. What is that layer? Do you know?
The ganglion cell layer?
Correct. So the ganglion cells are like, I guess, super VIP cells, and they really are, to be honest with you. That's where everybody sends their information. Ganglion cells get their own name. They're super VIP. They're so in the club, they get a name named after, a layer named after them. The ganglion cell, but it's still a cell. Cellular, meaning it's going to be a little bit darker than the guy next to him that he's being compared to, because he has fluid and cellular material, whereas the nerve fiber layer is super packed with just dense axons. Does this make sense?
Yep.
Okay, so I'm going to point again. What is that one called?
The nerve fiber layer.
Nerve fiber layer. Just remind me, light or dark? Which one is this?
The nerve fiber layer is light.
You got it. I mean, very light, right? Very, very light. And then how about that guy right there?
Ganglion cell layer is dark.
And it's dark. Okay, so we're going to do rapid fire now, okay? You're going to tell me what the layer is. And then I always say, it's the first time, it's always like, you know, I don't know what, I'm confused. Start, if you can't figure it out, okay, tell me light or dark, and then build from there, okay? So let's do this. All right. So I am pointing.
So it's dark.
You got it.
That means it's nuclear. So that's an internuclear layer.
You got it. Internuclear layer. Done. How about that one?
That is the ganglion cell layer.
You got it. You absolutely. I hate when teachers do this. I hated it when I was younger. And then here I go. I pointed to an exception after teaching this other side, right? But I just want to show you, you know, it works on both sides, but you got to really look and make sure, okay, well, I saw that light layer that's sitting right above it. It may be thinner, but that's not what he's pointing to. He's pointing to something right under there. I'm going to shoot with ganglion cell layer, and that was exactly right. Okay. How about that guy?
That's the outer nuclear layer.
Outer nuclear layer. You got it. How about that guy?
That's the nerve fiber layer.
Nerve fiber layer. How about this guy?
Inner plexiform layer.
Got it. And that's inner plexiform layer. How about that layer?
Outer plexiform layer.
Got it. How about that? What is he?
Vitreous.
Right. Always. Vitreous is dark. That's what all of this is kind of based on. We're going to do it a second time. Okay. Let's do it again. Okay. Here we go. Pointing again. What is that layer?
Outer nuclear layer.
Outer nuclear layer. How about that one?
Inner nuclear layer.
Inner nuclear layer. How about that?
Vitreous.
Vitreous. How about that one?
Ganglion cell layer.
Ganglion cell layer. How about this line here? The band here.
Outer plexiform layer.
Outer plexiform layer. How about this band here?
Inner plexiform layer.
Inner plexiform layer. How about that one?
Nerve fiber.
Nerve fiber layer. One more time. Okay. One more time. Here we go. What's that one?
That's inner nuclear layer.
Inner nuclear layer. How about that one?
Nerve fiber layer.
Nerve fiber layer. How about that one? Again, this line here.
Outer plexiform layer.
Outer plexiform layer. How about that one?
Ganglion cell layer.
Ganglion cell layer. How about this?
Vitreous.
Vitreous. And then how about this?
Outer nuclear layer.
Outer nuclear layer. And then how about that one?
Inner plexiform layer.
Inner plexiform layer. Final time, I lied, okay? All right, so here you go. How about this?
Nerve fiber layer.
Nerve fiber layer. How about this line here?
Outer plexiform layer.
Outer plexiform layer. How about this?
Inner nuclear layer.
Inner nuclear layer. You got it, right? How about this?
Inner plexiform layer.
Inner plexiform layer. How about that?
Vitreous.
Just move the arrow. You know, it didn't change the substance. How about that?
Ganglion cell layer.
Ganglion cell layer. How about that?
Outer nuclear layer.
Outer nuclear layer. You got it. One last thing. Again, one last thing. We were sitting over here and we're like ganglion cell layer, and then, you know, inner plexiform layer, and you're like, well, Dr. D, like these look like one big amorphous layer, right? I mean, that's the confusion in this case. I can't see light and dark alternating. We're kind of inferring, but you're not the only one. I'm going to show you a bunch of legitimate like papers that don't even try. Look at it, says ganglion cell dash inner plexiform layer thickness. They're not even trying to measure the distinction. So just know you're not the only one, okay? And so that is bands, okay, for today. And then the next time we're gonna do lines, okay? So hopefully this is helping. It just allows you to framework it in a simple fashion. Okay.
Thank you. Yes,
Yep.
this is awesome.
Okay, so I will email you for, this was a quick one, and the next one's gonna be a little bit longer, and then I will email you when to do that one, and you let me know if you can do it, okay?
Okay, perfect. Thank you so much, Dr. D.
No problem. Okay, bye.
All right, bye.